So I would write down renal colic equals kidney stones. Kidney stones is like the layman term that we use for renal colic. And the biggest thing here is flank pain. So this flank pain here, if you guys see this on the NREMT, and there's no other indication for anything else, flank pain, just in a medical setting, go ahead and just red flag kidney stones, okay? And if that's one of the answers, there's a good chance it's gonna be this, as long as there's nothing else going on with the patient but flank pain. I highly recommend that you write down flank pain equals possible kidney stones. And he's like, get that in your brain. It'll help you out with the question for sure. All right, so cardiac involvement. So because the nerve endings, sometimes the nerves that connect to the heart, they also connect to other parts of the body. And as those nerve endings go back into your spine, they'll connect, and those messages that travel to your brain will sometimes crisscross each other. And I hope that makes sense. I'm trying to make it as simple as possible. And if you have some kind of cardiac issue, your patient might feel it in your epigastric or in the middle of their back. Now, for some reason, from my understanding and my experience, most of your patients that are having like a heart attack or some kind of cardiac issue where they have epigastric pain, but it's cardiac in nature, usually it tends to be a female. Not sure why that is, but that's just a good little side note to have. I'm gonna go ahead and see what this video is about. Can you guys see that or no? The video? I'm gonna switch sharing just to be safe. All right, here we go.
Common location of abdominal aortic aneurysm. The most common location of abdominal aortic aneurysm is between the renal and iliac arteries. An aneurysm is luminal dilatation caused by degenerative changes in the aortic wall, leading to an increased vessel diameter and bulging of the abdominal aorta. Eventually, the degenerative changes may lead to rupture of the aneurysm.
Oh, that was pretty simple.
The most common location
assessment and care of abdominal pain or discomfort. History specific to females. So these are questions that obviously we would want to ask females because it could be a menstrual cycle issue. It might not be anything else. So, where are you in your menstrual cycle? They might be a little late, they might be a little early, that affects it. Is your period late? Do you have bleeding from the vagina that is not menstrual bleeding? And the reason you have to ask them is because patients won't always tell you everything, and or patients can't really link things up together because they haven't been trained, so they don't know any better, obviously. So you'd want to go ahead and ask the questions because you know what's going on. Different possibilities that could be causing that pain. Have you had this pain before? All these questions. Sample history, again, this is a mnemonic that we use for every single patient, regardless of what the issue is. If they can answer these questions, we want to know them. And that's because it's going to help long-term with patient care at the hospital. So if they're allergic to any medications, we have to know that. If they're taking any medications, not only is that good to know for the hospital, but it also helps us paint a picture of the patient and how they are in general. Obviously, pertinent past history. So pertinent meaning that it pertains to the actual medical call that you are in at the moment. So if your patient has chest pain, we're only going to ask questions that pertain to the thoracic cavity, whatever's inside that chest, the lungs, the heart, things like that. The last oral intake, this is good for the hospital, but it's also good because what if what they ate was the issue? What if that's causing the emergency? And then just general events of what happened right before the medical issue started occurring. See, geriatric. So with geriatrics means that's your older population. Now, I believe it's from 60 or 65 years of age and above. So you just look that up. But we do have a chapter on it that's coming up. But geriatric just means that's for your elderly population. And the side note is telling you that if your patient has pain, really pay attention to that pain, because as you get older, your nerve endings are not stimulated as easy. So if the stimulation is not as easy on your elderly population, then they won't feel pain as easily as a 30-year-old or a 20-year-old. So if they actually feel pain, pay attention, because it could be a serious issue because of the nerve endings being so deteriorated. More serious causes of abdominal pain. Again, like for example, the abdominal aortic aneurysm that is bursting, that tearing pain. If you have a tearing pain in an elderly person, I would be concerned that it could be a life, like it says here, a life threat from a tear in the aortic, that's in the abdomen area. See, physical examination, distension, we talked about that. That's the stomach bulging out. Discoloration could be like bruising. Protrusions, it's something that's like sticking out. Every time you see palpations, think of touching. Palpation means that you're touching something, you're feeling something. Use fingertips, and we always palpate the area of pain, the region of pain last. And the reason for that is because if we palpate that first, that pain would distract your patient, and they're going to be focused on how bad that area hurts. So when you're palpating around that area, they're not even going to really feel that or even care, because they're already in so much pain from you palpating where it actually hurts originally. See, palpation, you're looking for rigidity, means like stiffness, pain, guarding. Obviously, at this point, you guys all know what vital signs are. And chapter review.